Good afternoon, everybody. I would like to welcome you to the IOSH Public Services webinar on violence and aggression in public services. And this is the first of what I hope will be a number of webinars. And as we move forward across the next 12 months or so, we'll try and deliver more sector specific. I appreciate there's a lot of people on this event. And one of the things we do realize is we cover such a broad range. Trying to cover everything in one session was always going to be difficult. Having said that, the speakers we got lined up today have been clearly tasked by myself to try and cover the broad range and hopefully give you an organisational approach that you could then take back to your own workplaces and at least gives you food for thought as we go forward. So we've got a tight agenda today. We do hope to get finished and give plenty of time for question and answers. But if we don't, what we intend to do is upload this video onto our microsite at the IOSH Public Services and also try and put any of the questions that we didn't have time to get to on there. So hopefully it'll be really useful for you. So with that in mind, I'll introduce the panel. So we've got Nick James from the Health and Safety Executive. So if you can just give a little wave then. So he's going to lead off. Then we've got Bill Fox from Maybo, who will introduce himself when he comes on. And then Kim Sunley from Unison, who's going to give us a sort of frontline employees perspective, which I think we always forget sometimes in these organisational approach. So I'll continue to host. I'll keep an eye on that question and answer bar as you come through and pick some of those themes up. So I'll just hand over to you, Nick, if I may, please.
Good afternoon, everybody. Just bear with me while I share my screen. Hopefully you can see that PowerPoint presentation now. Yeah, good afternoon, everyone. As Stuart said, my name's Nick James. I'm a Principal Inspector with the Health and Safety Executive. This week actually marks my 30th anniversary working for HSE. I started as a trainee inspector in Bristol in 1991, although I've been based in Sheffield since 1997. In those 30 years, I've worked across a wide range of industry and business sectors, including our hazardous installations division, been in both frontline and operational policy roles. And since November of last year, I've been working as head of the public administration, education and volunteering sector, public administration covering both central and local government. My team sit within HSE's Transport and Public Services unit more widely, and other teams cover the transport sector, health and social care, as well as emergency services and MOD. And I'm pleased to have the opportunity today to be able to talk to you about violence and aggression in the wider public sector. My intention this afternoon is to cover the following, to look at HSE's definition of violence. It's not the only definition that's out there, but it's the one HSE worked to. Consider the scale of the issue across all sectors, but particularly looking at what we know about the level of violence and aggression in the public sector and those most likely to be at risk. As it's an HSE presentation, it couldn't get away without saying something about the applicable legislation and a bit about what that means in practice. But particularly just wanted to focus on some of HSE's most recent inspections focused on violence and aggression in the public sector and lessons that can be learned more widely from those. Finally, just to let you know a little bit about ongoing and future work on violence and aggression by both HSE and others we're collaborating with, and just to sum up the available HSE guidance on the topic as well. So in terms of definition, you can see that on the slide. It's important to note that that's the definition of work-related violence, and to note that it includes verbal abuse and threats as well as physical attacks. So taking that as our definition, then what is the scale of the problem? Our main source of evidence on the scale of violence and aggression in the workplace comes from the crime survey for England and Wales, and you can just see the graphic there. Other sources, the labour force survey and Riddle reports as well. But it's important to note that all the reports that we get, particularly related to Riddle, we know are likely to be underreported. That's possibly because employees or staff have normalised violence and aggression as being just part of the job, or believe that nothing will be done if they do report the incidents. And that's important to note when you're looking at determining the scale of the problem within your own organisation, and also emphasises the importance of engaging with your staff on the issue. So as you can see from the graphic, in 2019-20, there were, according to the Crime Survey for England and Wales, an estimated 688,000 incidents of violence at work. So that's 299,000 assaults, 389,000 incidents of threats. And those incidents involved an estimated 307,000 adults. Disparity in the figures there probably resulting to some extent in terms of incidents happening to an individual more than once over that time frame. Although that estimated number of violent incidents at work does fluctuate from year to year, the risk of being a victim of actual or threatened violence has remained the same over the past few years, or broadly similar, with an estimated 1.4% of working adults being the victim of one or more violent incidents at work. As I mentioned, HC statistics on injuries sustained as a result of violence, specifically the ones that within our organisation come from Riddle reporting, which requires employers to report certain workplace non-fatal injuries, as I'm sure you're aware, and those are generally the more serious ones, where people have been off work for more than 7 days, are unable to do their normal work for more than 7 days as a result of the incident, or have experienced a major injury as defined. As I mentioned, it's important to note that those Riddle cases are known to be underreported and so won't capture the full scale of the issue. That said, there were 5,638 Riddle reported cases in Great Britain, and that accounts for about 9% of all Riddle reported non-fatal injuries, similar, as I said earlier, to the proportion in earlier years, and supports the results of the labour force survey as well. We currently don't have any figures for 2021, so it's not clear what impact the pandemic has had on work-related violence and aggression. According to the ILO, the rates of violence and harassment, whether that's physical or psychological, are likely to have risen during the pandemic. And also organisational change, particularly work's been reorganised. Physical work environment has changed, as has happened during the pandemic, can be factors that increase risk. So in terms of the consequences for people experiencing violence at work, so it can be both physical, can be emotional consequences if you are a victim of violence and aggression, and workplace violence could impact upon people's health as well as their safety. So whilst the majority of injuries sustained in a violent incident might be classified as more minor injuries, there are some, and a proportion, that are more serious and can cause longer term physical and psychological harm to those individuals that are experiencing it. For employers, violence can lead to poor morale in the workplace, perhaps a poor image, public relations image for the organisation, could potentially make it difficult to recruit and retain staff. And it can also mean extra costs as well in terms of absenteeism, higher insurance premiums and compensation payments. And as I said, for employees particularly, it's the pain, distress that can be caused. Obviously dangerous, serious, persistent verbal abuse can also be damaging as much as one-off incidents. So who is at risk? Well, I think primarily those that are working in contact with the public, that they form a significant percentage of those people that suffer workplace violence and aggression. But that can also more widely include people that are working alone, people that are working with people who are perhaps in distress themselves, working particularly with valuables or cash handling. Clearly there's risks associated with that, and working in isolated or remote locations, particular evening or at night as well. There's a lot of emphasis, I think, in policies, procedures on lone the risks to lone workers. Rightly so. Whilst lone working doesn't always mean a high risk of violence, clearly workers can be more vulnerable when they are working in isolation. And interestingly, the labour force survey, in terms of what we're concerned with particularly today, does show that around 9 out of 10 workers who sustain an injury resulting from violence at work are employed in public services in some capacity. And I think Riddle results reports do reflect that as well. So it's clear that many people in the public sector, as well as those more broadly, face risks from both verbal and physical violence as part of their normal working day. As I said, it wouldn't be an HC presentation without covering the relevant legal requirements in brief, because I know most, if not all of you on the call, will be health and safety professionals or have a significant interest in health and safety matters. So I'm sure none of this will be new to you. But for the avoidance of doubt, health and safety law does apply where there's a foreseeable risk of violence and aggression to the workforce, where it may arise out of or in connection with the work activities that they're engaged with. So incidents not arising out of or in connection with work aren't covered by the Health and Safety at Work Act and related legislation, and are therefore beyond HSE's remit as a regulatory body. Clearly, we've got the Health and Safety at Work Act, particularly duties towards employees, to ensure their health, safety and welfare at work, so far as is reasonably practicable. The management regulations, particularly the requirements around risk assessment, requiring employers to determine how significant the risks are to their workforce, decide what to do about it, and to prevent or control those risks through developing a clear management plan to achieve that end. I've mentioned RIDA already, and the requirements there on the responsible person, usually the employer. I think one of the, in relation to this particular issue, but obviously others as well, I think the Safety Representative Safety Committee regs and the Health and Safety Consultation with Employees regulations are key aspects here. Obviously, employers need to inform and consult with their employees on matters relating to health and safety generally, whether that be trade union reps or those otherwise elected or representing the workforce. And engaging with your workforce is absolutely key to managing the risks from violence and aggression. They're the ones who are experiencing the reality of the violence and aggression towards them, and they're going to be best placed to help you identify the scale of the issue, help you understand the causes relevant to their particular work, and therefore most likely to get the most effective and practical control measures in place to prevent and reduce those risks to staff. And although not enforced by HC, just to mention as well, to the Corporate Manslaughter and Corporate Homicide Act, in terms of the duties on corporations, organisations, in terms of manslaughter as a result of potential serious management failures that result in a gross breach of duty of care. So what does that mean in practice in terms of effective management? Clearly, find out if you have a problem, first step. And that will be done through essentially undertaking a risk assessment to find out if you have a problem, and if so, the nature and scale of that problem. And then step 2, deciding what action to take. So identifying which employees are at risk, evaluate the risk, for example, by checking the level of training and information that's being provided, but also considering the work environment and the design of the job or the activity that they're engaged with. And then also obviously checking what has been done, monitoring and reviewing, and learning any lessons that you can from that. So it's important to remember that those 4 stages aren't a one-off set of actions. So if you find sort of at stage 4, and when you're reviewing, monitoring, that there's still a problem, then essentially start the process again. So in terms of stage 1, finding out if you have a problem, emphasised earlier, and I think it's worth saying again that the importance of talking to your staff, engaging with employees, whether that's informally through managers, supervisors, safety reps, or perhaps something more formal in terms of a short questionnaire, so that you can really identify whether your employees do feel threatened, and if so, what those circumstances are. Keep detailed records of incidents, again encouraging staff to report incidents where they can, and here's where I mentioned earlier about the importance of engagement. If staff are reporting issues to you, then clearly that if they're going to continue to do so, they need to see that something is happening as a result of them reporting those incidents. Otherwise, there is the danger that they just see it as, well, I'm not going to report it because nothing's going to happen, or it's not going to be taken seriously. And then you don't really get a good picture of what's happening until perhaps something more serious does happen. In deciding what action to take at stage 2, clearly, as I said, you need to decide who might be harmed and how. Identify the particular employees who are going to be at risk, potentially everybody, and certainly everybody that might have a public facing role, and those that have face-to-face contact with the public, as we've said, are often amongst those that are potentially most vulnerable. So check your existing arrangements, the precautions you've already got in place adequate, or do you need to do more? Think about things like the level of the training and information you're providing, but also, as I mentioned, the environment and the design of the work as well, and how those factors work together to influence the risk of violence and the steps you can take to address it. And again, it's important to keep a record of the significant findings of any assessment that you do undertake, not just for the sake of it, but as a working document. So not something that sits on the shelf, with the policy and procedures, but it is something that can be used as a working document, really, for both managers and staff as well. Clearly, you need to act upon the measures that you've identified at stage 3 in terms of what's reasonably practicable to achieve. And as you mentioned at stage 4, important to check what you have done, to check on a regular basis how well those arrangements are working, consulting with employees or their representatives as you do that. And if the measures are working, great, keep them up. If it's still a problem, then try something else and go back to stage 1 and 2 to identify other preventive measures that could work. And be prepared to add further measures or change existing measures where those aren't working. And that's particularly important where there's a change to the job, where perhaps there's organisational, structural changes in the working environment, and to then take action as a consequence of that, and reviewing what measures you have in place. I said I'd just talk briefly about recent HSE interventions. The most recent inspections focused on violence and aggression in the public sector certainly took place in 2019. Inspectors going into workplaces, when they're looking at the hazards, the risks faced by the workforce, will always consider violence and aggression perhaps as one of the issues to look at, and certainly they'll pick up on anything if they feel that it's an issue that hasn't been addressed, that maybe crops up during an inspection. But these interventions were specifically focused looking at violence and aggression, and they were also focused on healthcare premises. This is work that was undertaken prior to the pandemic, of course. HSE inspectors visited 20 healthcare organisations, of which 50% to half were found to actually be in material breach, which means that they weren't complying with the legal requirements either under Health and Safety at Work Act and or specific regulations made under them, which I covered earlier. As a minimum, identification of a material breach will result in the inspector writing to the organisation requiring action to be taken, and you may be aware that's called a notice of contravention. Of course, those requirements can be formalised by service and improvement notice as well, which gives the duty holder a minimum of 21 days to comply. As a result of those interventions, only one improvement notice was served, but it's important to note that whether it's a notice of contravention or an improvement notice that's served, that inspectors do follow up on those interventions and check that action has been taken where it's required. And if not, if organisations fail to act, then that can lead to further enforcement action. So in terms of the areas for improvement that were identified during those interventions. There were good elements of good practice identified, but there were a number of areas particularly that were identified as requiring improvement. And this slide really sort of sums up the key areas that certainly that I'd like to draw to your attention this afternoon. Although they do obviously relate specifically to the healthcare organisations that were inspected, the issues are likely to be reflected in the wider public sector and are certainly worth noting when it comes to duty holders reviewing the effectiveness of their own management arrangements and measures in place to prevent and control the risk of violence and aggression to staff. So whilst it's good to note that policies for managing violence and aggression were in place pretty much across the board, one of the key issues that was found was that despite those policies being in place, that there could be poor implementation of those policies, particularly when it came to the front line. So whilst the paperwork looked good, reality was that conditions on the ground didn't necessarily reflect the policy intention. Identified that in some cases there was poor or even no training related to the carrying out of violence and risk assessments related specifically to violence and aggression. And this, bearing in mind it was healthcare premises, these were usually being undertaken, I think, at sort of ward manager level, and they hadn't always been trained to be able to carry out that task, which meant that risk assessments that were carried out were not suitable and sufficient, and in some cases the assessments weren't really carried out at all. So in other words, really the process to identify what the risks are, the level of risk and the reasonable practical control measures to be put in place hadn't been followed. So unless you actually go through those steps and do the risk assessment, identify all those things, you're not really going to end up with effective control of violence and aggression risks at the sharp end. There was also a lack of evidence of organisations having proactive performance indicators. Inspectors identified that in many cases there were no widespread leading indicators. They were often lagging indicators that were in place in terms of measuring performance on how well the organisation was managing violence and aggression risks. And that was generally with the exception of training in terms of identifying those that had been trained in de-escalation or addressing violence and aggression and how best to deal with that in the particular workplace. And just in terms of that as an indicator of or assurance that you might glean from saying, yeah, well, it's okay, we've provided everybody with the training. It's really important that training isn't just seen as sort of a tick box exercise, as often I think these sort of annual updates of certain things, dare I say, like sort of, you know, fire training and security training and so on, often has just been something that's I just see as something I need to tick the box and get it done. And then the organisation sits back and takes some assurance that everybody's done what's expected without actually looking more deeply to see, and perhaps having a wider range of measures to determine whether things are actually working in practice and are effective. And that's where we found that perhaps there were issues with monitoring and review, that assurance process, and that organisations were perhaps drawing false assurance from the data they had, particularly in relation to provision of training to their workforce. So in terms of future work, unfortunately, as perhaps no surprise, our focus has very much been on the pandemic response over the last 18 months. People working in different parts of HSE and pulled into different roles to meet the demands of the pandemic and all that's been needed there. So any further planned interventions we had beyond those which I've described back in 2020 weren't progressed at that time. That doesn't mean to say that the issue's been forgotten about or that no progress is being made. You may be aware that the Thomas Ashton Institute is undertaking research on work-related violence and aggression. They're part of Manchester University, and HC is working in collaboration with them on a research project to look at the learning and regulatory insights that can be drawn from the research that they're undertaking. So the aims of that research are to obtain a better picture of the extent of the problem across sectors, to raise awareness and to improve reporting and prevention measures. That work's ongoing, and I believe it's currently focusing on drawing together real-life case studies, which will of course in turn benefit others in tackling the issue for themselves. Work's also ongoing to update HC's Violence and Aggression microsite to make it perhaps more of a one-stop shop for all the guidance and support on the issue that's available there. Also intending to progress further healthcare inspections during 2021. In fact, I believe some of those may already be underway. My team are involved with the Local Government Association, the LGA, and particularly the London Council subgroup, who are developing violence and aggression guidance specifically for local authorities, which we trust will be sorted this work year. So perhaps look out for that in future. And we're also actively considering whether violence and aggression should be a priority topic for further public sector interventions in the next work year, 22-23, although that's not yet confirmed. And finally, as I said, just to give you a flavour of the guidance that is available on our website, couple of fairly long-standing leaflets there, the INDG 69 and 73, looking generally at violence at work and then more specifically at lone workers as well. There is some European guidance on preventing workplace harassment and violence, which HC supports, which is on our website. And specific, because I've mentioned health and social care, there is specific guidance on the website on that topic and for that sector as well. So that really draws to a conclusion what I wanted to cover this morning. I hope that's been of help to you. I believe we're planning to take questions at the end of the everybody's sessions. So at that point, I'll hand back to Stuart. Thank you.
Thanks very much, Nick. That was really hit the nail on the head. I think that hopefully the participants found that really useful. So I'll pan straight over to Bill and we'll pick up those questions and answers at the end if we could, Nick, please. So Bill, over to you.
Thank you. Okay, well, thanks. Really good to follow Nick, and I'll pick up on a couple of points that he raised, actually, I think, and I'll try and build on those. It's great to be back at this forum. It's a long time since I last presented at the Public Services Forum for IOSH, and a lot has happened, and some good, and it seems recently quite a lot that's bad. Certainly that's the way many of our colleagues and the people they serve will feel about life. And work-related violence has always been challenging. It's a complex risk, you know, it's unpredictable at times, and it always seems to be moving, always dancing. And right now, it really is challenging. So I'm going to have a little look at some of the current challenges, looking at, I think it's really important to look at the frame, you know, what are we actually focusing on? What is the conversation? What's the narrative? And then looking at some of the emergent guidance and regulations, strategies that I think can cross all sectors, because I'm very conscious this is a diverse audience we have today. And the other thing I'll touch on, I think, is, as well as strategies, I'll hone in on training, because there's been quite a lot of advances in training. And again, training is something that crosses all of our interests. Wherever we work, it's something we have an input on and can advise on as health, safety and risk professionals. So in terms of the current challenges, we've certainly got, started actually a few years ago in the build up to Brexit. You know, many of you will have had feedback from colleagues, particularly colleagues, maybe European colleagues, who were feeling really quite uncomfortable at times, were made to feel uncomfortable. You know, there were comments, there was the edge. And then we've seen now, of course, the COVID conflict. And some of that adds, often we have to enforce restrictions, for want of a better word. And certainly with COVID, we've had plenty of practice. Very uncomfortable, very emotional for everybody. So we've ended up really with stressed workers. We've ended up with stressed service users and customers. We're also, I think, supporting, we're finding in services, and many of you in health, education and social care have seen this, we're supporting even more vulnerable people than we have been. They're especially vulnerable at the moment. Lots of mental health issues, trauma, etc. We've also got the challenge of emerging sector requirements. These are very considerable in some sectors. I'm going to touch on those. And I think there's a massive issue right now around the ability to recruit and keep any staff, let alone the right staff. There's a small pool we're drawing on where maybe people are coming into workplaces where maybe they don't share the right values. There's only so much we can do. It's a big challenge, but at the moment it seems to be like getting anybody. Now, I don't know if you noticed on my first slide that I actually was dancing around this title because the theme is really about violence towards staff. And I want to look at that because I think the frame of this is really important when we set out in our own services. And some of us on this call, have got a fairly focused, perhaps need around the safety of some of our lone workers, some of the interactions they may have with members of the public. Important, but relatively straightforward to manage. And some of us have got quite complex or oversee other services where we've got quite complex needs. We've perhaps got an ongoing relationship with the people who are in those services, whether they be children or whether they be adults. And there's a lot of factors in play there around this issue. So we're going to have a little touch on that. Well, framing. There's certainly violence and aggression on staff often has an assaults focus, a reducing assaults focus. We often talk about behaviour management strategies. We talk about sanctions and enforcement. It's kind of on the basis of protecting our colleagues from the people they serve and the general public in some cases. And so the extreme of that, if you like, is zero tolerance approaches, which many of us are familiar with, going back some years. And I'm not saying there's not a place for real firmness and clarity and about expectations of behaviour and what's right and what's not. And I'm a firm believer that we shouldn't just go back to those days where getting hurt was part of the job. That's not acceptable. At the same time, I think the zero tolerance narrative, if you like, and I appreciate that's an extreme of this position. It's adversarial, and it often causes more problems. In the short term, it sometimes provides some gain. In the mid to long term, in my experience, the gains are limited, and it really can be quite adversarial. So I get where this comes from because it's a very emotional subject, and we tend to react and look for answers. Now, here's another narrative. And for those of you who are in health, education, social care services, you'll be very familiar, I'm sure by now, of emerging guidance. We've had it from DH, we've had it now with the Restraint Reduction Network, which is CQC backed, NHS England backed. We've got training standards. And the focus of these is around reducing restrictive practices, which can be quite range from restraining people to actually practices that are just almost staff don't even realize they're restrictive. They're just limiting access. They're telling people when they can and can't have their meals. They're limiting access to money, to visits, etc. So it's the whole thing about restrictive practices. There's a big focus, quite rightly now, and it's very focused on relationships, about respecting human rights, acting in best interests, and also really understanding, looking behind the behaviour. And trying to meet needs and reduce the distress that many people are experiencing, especially at the moment. It kind of feels at one level, you could look at this, well, this is about, the first approach, zero tolerance, was about protecting our staff from service users. And this one is perhaps feels a bit at times like protecting service users from our staff. And there certainly has been a strong element of that. So I think for me, we need to look at these and where we stand on them, and also what strategies will help going forward. Before I do that, there's a little bit more here again on the promoting human rights. I was just trying to concisely take my summary of Ofsted's focus, which is about very much drive around behaviour and attitudes, relationships, safe and respectful environments. CQC focus across health and social care, reducing restrictive practices, a big drive for them now, and closed cultures, which we'll touch on, and the restraint reduction network, which has been created to really promote that and is doing is really gathering steam. We've got the HSE then, of course, and we've heard from Nick and are very clear about them and their role about, and of course for health and safety in the workplace for all. It's for all, and I think this is a really key thing for me. Whilst it may sound like we've got competed narratives, and I think sometimes the frame of problem can become part of the problem, especially if it's about good guys and bad guys, then that's going to be problematic. For me, to effectively address emotionally driven conflict and violence, whether in a passing interaction with a customer or a member of I can't even now. I can't even see my screen now. Let me move this down. Or a customer or a member of the public, or in the context of an ongoing relationship. And this is a key difference, isn't it? So many of us, there's an ongoing relationship with a child or adult in our services or in our schools. We need a considered approach that delivers positive outcomes for everyone we serve. And that's the key to me. It's these things, it isn't just about staff safety. That won't work. It isn't all about, we come to work and it's only about the safety of those we support. These work hand in hand. They're not mutually exclusive, and they need to be part of a multi-strategy approach. Now, what I'm going to do now is have a look, firstly compare what some of us would be familiar with as strategies for violence reduction, with strategies now, the more emergent strategies around reducing restrictive practices. And you know what I think, and you'll be the judge, but I think these really do go hand in hand. There's a lot of similarities. So let's just look for a moment at the violence reduction strategies. Now, typically comprise of proactive and reactive approaches. Makes sense? Preventative first. Well, the classic approach really over the years, and I think Nick highlighted it in his presentation, is that we have training's a big one, isn't it? And it's one that's expected to be done and ultimately isn't all that well evaluated and not necessarily that effective, but we'll come back to that. I think there's training, there's technology and equipment, has been access control, lone worker monitoring, emergency communications, policy and guidance. These are things that have almost been at the foundation of a lot of strategies over the years to improve staff safety. The equipment and technology, of course, has improved. I mean, look at training, but equipment and technology has improved a lot. I mean, we've got lone worker communications are incredible now. Some of the person in the room, who can come in and see and talk, over a speaker, that can be quite powerful. But we've also got body cameras. In some roles, body cameras have been incredibly effective. Actually, been really good also at inhibiting staff behaviour as well. So that's a kind of classic approach. Now, part of the problem is that it doesn't necessarily give us the results. It steps in the right direction. But we know actually that, for one example, is that culture just is so powerful. Now, I've got very real experience over the years, very personal experience as well. I've been involved in working with organisations that have had tremendous success in reducing risks to staff and the people they support, and really improving those organisations, really positive, really healthy cultures. It's been great to be part of that. I've also been part of some nightmares, and it just reminds me of just how powerful culture is. You can do all the wonderful training, you can do lots of other steps, but you know what? We've really got to get behind this. And I think this has come to light again recently. in recent tragedies and on the news, where we hear about culture, closed cultures, cultures where people won't challenge, our colleagues won't call each other out. The sign of a really positive culture to me is when somebody says in the team, not a supervisor, one of the team who says, Bill, we don't do that around here. That's a real, when we're there, then that's, we're really making progress. So what does a more, if you like, holistic strategy, violence reduction strategy, multi-strategy approach involve? Well, a lot more than just training, policy guidance and equipment. There's a whole host of things in there that, you know, we could go into and that we've all gone over many times, no doubt, about the things that we need to have as part of our multi-strategy approach, or sometimes referred to as a multi-element strategy. We've now got a, so let's compare that then with the drive at the moment, which some of you I know, and Stuart's asked me to cover this because so many of you are support and services, health, education, social care services as well. And there's a big drive with the restraint reduction training standards. I'm a big advocate of the Restraint Reduction Network. I'm involved in it, proud to be involved in it. You know, it's a big task. It's setting out to create positive and safer services, but it's been taken really seriously, and it's got really strong support. So if you haven't heard about it, you're going to hear about it. Now, what I like about the approach with the Restraint Reduction Network is they've got training standards, but they've also recognized that that isn't going to fix it. So again, it lines up with our violence reduction strategy. They recognize that for safer services, we have to do a whole load of other things. And that's why it comes with the safer services guidance. So training is not just in isolation. Now, the bit I like best here within this guidance, and I'll provide you some links later, is the way they put together a couple of models here. One on the right-hand side, well, it's on my right, is the British Institute of Human Rights model, which is looking at human rights. Now, this, as you'll see, is very focused on the rights of the people who use our services, but also our staff have rights. And I think we can look at that, whatever our service, look at that through the lens of the rights of our staff and our service users. On the left, on the other side, we've got these 6 core strategies. Now, some of you will be familiar with the work of Kevin Ann Huckshawn. Fantastic, absolutely unbelievable work. I've had the pleasure to listen to Kevin Ann Huckshawn, based in the States, talk about her work in transforming services, bringing violence levels right down, bringing restrictive practices down, staff and the people they care and support working together. And she identified 6 core strategies which are evidence-based. Now, the Restraint Reduction Network has adapted these, and you'll see if we look at the first one, leadership. Well, it always begins and falls with leadership, doesn't it? You know, often things are just done as passing stabs at reducing violence. But, you know, there's got to be a whole organisational approach here, signed up from the top. There shouldn't be something left to a training department or the health and safety team. Everybody's got to be part of this. It's to be effective, and if it's to change practice. Data collection, point 2. I don't need to tell you folk about data collection, but I tell you what, we still go wrong. You know, and I think back to when zero tolerance came in the NHS. Do you remember back then? Classic case of our nurses are getting assaulted, zero tolerance comes in, and we have huge support for that, understandably. But the strategy was all about that. It was about the framing of the problem was the patient or the drunk in A&E or the angry relative. And it wasn't that helpful, because actually, if they understood the problem by looking at the data which happened since then, they'd have recognized that the majority of incidents in where there was aggression and violence and injury and harm, in the majority of those, they were clinically related. Yeah, the ladder was up against the wrong wall. You know, that's why the training impact was limited, because the majority of the incidents were about people whose behavior was linked to their clinical condition and other issues, neurodiversity, other challenges that they had. You can't have a zero tolerance approach like that. It doesn't work. So let's understand the problem. Workplace development. Well, we're going to talk about that more soon, but you know, I think that's a big part of this, and it's not just about training. Then there's using preventative tools and strategies, number 4. You've got to turn your head upside down for that, unless you're really good on the information tech, computer screens and adjusting. But anyway, that's all about prevention. And you know what, we've already touched on some of those strategies, a whole host of positive strategies. Wherever we work, this isn't just about working in services where we have care for people. This is all of our services that we really need to be smart on prevention. And do you know what, a big part of that is about, well, not pissing people off, to be frank. And we've got to, wherever we work, there's no point in just firefighting and saying, you can't behave like that here, when all we're doing is winding people up. And unfortunately, that happens. And it's really tough right now when we've got limited numbers of staff and services are creaking. Number 5, involving people with lived experience. Now, the context of this is about the people who use our services, it's not just a conversation we have and we do things to them. Let's work with them, co-production, co-design. But you know what, it's also with that, I think that could be for those of us in other aspects of public services and even transport, in more customer service-based environments. Well, that's about talking to our customers and finding out, as we try to, what is it that they like and don't like? What is it about meeting those expectations so we get less conflict? And for me, is another thing, and Nick touched on it. For me in there is our staff. Let's go talk to our staff. And before we create, let's first of all help them understand what the real issues are in their perception. But let's also make sure the strategies we're going to come out with are workable, because otherwise culture eats for breakfast. And finally, on post-incident support and post-incident review, this is so massive, isn't it? About how well do we follow up and learn? How much do we invest in our managers, supervisors, team leaders in this? Not enough. We put a lot of investment into staff training around, it's health and safety related training, but we don't put enough into this and this is critical to helping make sure that training turns into practice in the workplace, and we review and follow up, and we provide staff support when they most need it, and the people in our services support when they need it, and they'll never forget the quality of support that we gave them or not. It's the test of leadership. Training. I think we need to think about what's a baseline for all frontline colleagues. Think then about role and setting specific needs and the additional needs of managers that I just touched on. I think the days of everybody going on a one-day course across the whole local authority, they're going, if they haven't already gone, really. It's a bit of a sheep dip approach. It's had benefits, of course it has, but I think we can be more focused, more precise in our training strategies, and need to be, because training needs to be relevant. A model here that, in terms of actually ensuring that training is fit for purpose. What is fit for purpose training? I've got involved over the years in a lot of cases where I've had to provide, and I've been asked to provide a view on what's happened. And in quite a bit in that, I'll ask for policies, I'll ask for training records, but I'll always ask for training needs analysis. I'm yet to get one. So how do you show your training is fit for purpose if you haven't done a training needs analysis? This is absolutely critical. We can't just use the language, and then we need to evaluate it and review it and make sure it is fit for purpose in practice. So classic things here, as you'd expect, policy and role expectations. Are we clear? And are we clear not only what our colleagues should be doing, are we clear about what they should not be doing? Let's look at the tasks and activities performed. There are inherent risks with certain tasks and activities that just go with the job. Our colleagues are doing enforcement work, or our colleagues who are supporting people who may at times present behaviours of concern. Let's have a look at that. Let's have a look at the training history and experience, the likely conflict and risk scenarios to make sure we make this relevant, the risk assessment and incident data to make sure we've got the ladder against the right wall, and the regulatory and sector guidance, and our customer consumer service user profile. is, how are we factoring in for some of our services, particularly in large local authorities? Are we really attuned to the people we support as a population? And are we actually attuning further to the needs of some of the individuals within those services? Now, learning technologies are, well, we all know about it, don't we? Look at us now. I guess this is some form of learning technology. Here we are. We're in the virtual world. Well, I hope you're still there anyway. I don't really know if you're still there or not. I haven't had any texts saying that, Bill, you're talking to yourself, but I hope you're there. Look, learning technologies are really exciting. We've got to be careful we don't get carried away with them and baby bathwater scenario. We've still got to, but they do play quite a role there. It's quite exciting at the moment. My belief and the belief of my colleagues is that, and we've really researched, and followed and been part of learning technologies, is that combination of conventional, if you like, face-to-face training in a room together with people talking about their challenges, especially for some of the practical elements, really scenario-based training, fantastic. But e-learning has really come to the fore. E-learning done well is really getting great feedback from services, getting great feedback in research. If it's done well and it's part of a blended strategy, not when it's just a bit of a messy PowerPoint put together as a cheap way to bypass anything meaningful. It's really about the quality. And the whole thing about the research says, it's not so much the medium, it's about the quality of it. Blended learning really can be a combination of e-learning, classroom-based, webinar like we have now, virtual classroom, which is a much more formal version of this. So a lot of people are doing virtual classrooms now. We really like them, our clients like them, where people are all on camera, all on, doing activities in breakout rooms. We're delivering learning outcomes. And they're doing really engaging stuff together with teams. So, virtual classroom can work really well and it can have rigor. You put together e-learning, virtual classroom, training, you have a proper blend of learning. And, it's better than before, to be frank. So let's have a little look at that, actually. I mean, one of the big things with blended learning is it's the use it or lose it scenario. You get the forgetting curve. People do training and then it doesn't take long for it to go. Research is saying, look, we've got a much younger generation, our population, who really want to have control over their learning. We're all getting better at it because of one positive thing coming out of COVID. I was looking for something good, is actually the advance in the way we can communicate and learn virtually. So, and there's something about two ways are better than one, and particularly for maintaining knowledge and skills rather than this, as Nick said, this annual or whatever, biannual or a refresher. So for me, effective ingredients of training, I would say, it's got to be, let's be really rigorous. If we want to, let's have a proper training needs analysis in there, that shows we have taken a risk and needs-based approach. It needs to be responsive, especially now, adopting a flexible, what we call a blended learning strategy. It's not something that's just a sheep dip. And I'm really keen on having the ability to support hotspots. How do we support a hotspot? For just that, how can we be truly responsive, and scenario based, absolutely critical. And I'm sure many of you feel the same. Respectful. Training needs to focus on understanding behaviors of concern, understanding the challenges our customers, our students, our patients experience, and not judging them. Because the worst, and all the years I've been looking at workplace violence and creating safer services, the worst scenarios and incidents, many times in terms of certainly subject of today, is about serious injury, harm, even death to staff. Some of the worst I've seen have where it has been said that staff were disrespectful. It almost, the inhibitions go if somebody's disrespected and they can justify somehow their actions. And also, it's simply wrong not to be. Supported. This is a key thing. How do we get past this culture piece and support transfer to the workplace? What are those strategies we touched on earlier? Of course, effective evaluation begins with establishing a baseline. So often evaluation comes in a bit later down the line, or can we evaluate that? When the best you can do down the line is a case study. We've got to start out at the beginning with an evaluation. I like a staff survey type approach. You can get perceptions as well, perceived capability, all sorts of things you can do in a good staff survey. That gives you a good start point. Down the line, you can put that back into play when people have been out in the workplace, been practicing their hopefully practicing their skills. You know, you can do that second evaluation. And hopefully you see my red line here, that's the one at the start, and the green line is the one at the end. So some references: the Restraint Reduction Network, a fabulous resource centre there. Look, it's got a lot of guidance. I'm not pretending it's pretty weighty. It's a bit content heavy. Some of the standards are very content heavy. You know, the Restraint Reduction Network's working on that. But what a, you know, the intention and the quality of the resources on that website, whatever your services, particularly though, if you've got an ongoing relationship with the people you serve, please do go there. CQC, I really like their guidance. You know, you can see on the web, just tap in, identify and respond into closed cultures. You can bring up some of that. Just what are some of the signs? Closed cultures, you could use another word, toxic cultures. You know, these are the cultures where we have seen things go horribly wrong. Whatever the investment that's gone in, we've seen really adversarial cultures, and we've seen abusive cultures. Good piece of guidance. NHS Protect, you know, this was a few years back now, but the NHS Protect guidance, meeting needs and reducing distress. If you're in health or social care, it's a great piece of guidance. You know, and if you can't find it out there, up there, just ping me an email and I'll send you a link. It's one of those crazy things. It's almost dropped off the web. You have to go and find it in different places. It's shame. Trauma is a big thing at the moment. Psychological trauma, a massive issue for our colleagues. We've got a traumatized workforce as well as traumatized people we support and care for. The Trauma Action Group, Tag Trauma, has some great resources on that. We're big fans. So go and have a look at the tagtrauma.com if that's something you'd like to look around mental health, but specifically trauma. And, you know, I've talked about online learning, blended learning, e-learning. Look, some of you will be pretty up on that. Some of you may not be. By all means, take a screenshot of this, take a photo or jot it down. For October, everyone on this webinar, you've got free access to, complimentary access to our whole store of different types of e-learning program, covering everything from lone working to supporting children, understanding behavior, working with older adults, through to trauma-informed approaches. It's all there. You can go in, and if there's something you're interested in as a topic, or you'd just like to see how e-learning can play a part, not necessarily ours, anyone's, even your own, have a look at this. You're very welcome. You've got a month's access to as many programs as you want there. I think I might be something in a record time in history for me. I might, Stuart, have finished on time.
Oh, thank you very much, Bill. No, I really appreciated that. You hit the brief multi-strategy approach. Hopefully this gives all the attendees just the opportunity to think that it's much more nuanced than simple slogan, zero tolerance. I hope everybody, certainly I know from my own organisation, I found that really useful. So bearing in mind time, and we want to get at least a couple of questions in. Kim, are you ready now? So hand over you, Kim.
Thank you, Stuart. Just share my screen. Great. I think you can hear me and see my slides, so I will kick off.
Yeah, that's fine.
Great. So thank you very much for inviting me to speak today to give an employee's perspective. Just a little bit of background about me. I started off my career in nursing many years ago, and has somebody in that occupation have been on the receiving end of certainly verbal abuse and witness colleagues being physically abused. So I guess I'm giving my perspective as a Unison national officer, but also bringing in some of my own personal reflections as well from my experience. So I have had a further career working for trade unions as a national officer of health and safety. lately I was with the Royal College of Nursing in their trade union team, and I joined the Unison National Officer Health and Safety in June of this year. So I'll be giving a perspective of our members working in those environments. So try and bring my slides forward. There we go. So yeah, just a bit of a background about Unison for those of you who don't know. We are the largest UK union, serving more than 1.3 million members, working in a variety of public sectors, but also providing private services, private public services too. We cover 12 regions of the UK, and significantly, we also represent well, 70% of our membership are women, so a large majority of our members are women workers. So what I'm going to do is just go through. So I'm going to set the scene, share some of the data that we have from our membership and from outside our membership, look a bit about what Unison have been doing around this issue, then look at the challenges from a perspective of our members, and then looking forward what actions we can do, and also work in partnership with trade union safety reps. And I'm delighted that Nick focused in on the role of working in partnership and engaging with the workforce and trade union safety reps. So just sort of giving a bit of background, I sort of tried to give a bit of a UK perspective here, and looking at Scotland, Northern Ireland, didn't manage to find any sort of Welsh data, but I'm sure it is out there. So we do a freedom of information request for violence in the public sector in Scotland, and that data is pulled together, 40,000 attacks on public sector workers in 2018, and 55% of those were actually working in local government. This social worker survey from Northern Ireland really stood out for me. 9 in 10 social workers experienced intimidation, and a half have been subject to physical violence. And the next survey, I guess I've come from a sort of health trade union background, and obviously very familiar with the issues in health and social care, but I never for one moment thought library workers would be experiencing violence and abuse. So this really stood out and shocked me. So 85% when we surveyed them back in 2008 suffered from violence and abuse. And that was, I spoke to my colleagues who lead supporting members in working in library services, and that was around the time where a lot of library services were being cut, closure times, a lot of stuff was being put online and automated. So again, that was a consequence of those changes to the working environments and working processes. This next headline comes from health, predominantly members working in the NHS, but I think it's really important, and I want to weave this into my presentation, how we can sometimes silo sexual harassment and violence, workplace violence, and actually one is dealt with HR and the other is dealt with by health and safety, security, occupational health, and sometimes we silo these two issues. And I think particularly with third-party sexual harassment, we need to look at bringing these two issues together. And again, that's a really shocking figure, 60% have experienced it. And the survey we did very recently, and again reflects on what Bill highlighted on. Our safety reps, we surveyed them back in middle of August, and 35% reported a rise in violence aggression from the public during the pandemic. And I do want to sort of focus in a little bit more on the COVID effect. And again, this is what our members have been telling us, and I think quite some really shocking stories as well. So again, we know people have been weaponizing COVID, sort of threatening to cough and spit on individuals, and that's sometimes linked with the enforcement of restrictions. So enforcing wearing of face coverings in public areas is sort of linked to those threats, and we know members have been abused because of that. Again, we've seen vaccine centres being subject to harassment and demonstrations, and we know that local authority staff have been supporting the vaccination rollout. So it's not just healthcare, it's other staff that have been exposed to that. And most recently, we've seen some harassment and demonstrations outside schools with the rollout of the vaccine to younger people. So those are kind of the sort of direct impacts of COVID, or also, verbal abuse. So again, our members delivering care in the community, also kind of very early on in the pandemic when they were putting on their PPE, were being sort of shouted at and abused and being told they were spreading disease. I think that happened quite early on in the pandemic, and hopefully we haven't seen so much of that of late. And then the kind of three sort of remaining sort of two areas really I just want to pick up on. And again, domestic abuse potentially doesn't necessarily cleanly fall under the Health and Safety at Work Act, but I think where people have been put in a situation where they've been moved to home working for all the right reasons, and home working has been really beneficial for a lot of people. Some people have been put in a situation where they're with the perpetrator of domestic abuse. That perpetrator may also be furloughed or maybe working in the home environment. So it's acutely raised their risk of domestic abuse. And again, we know the data on domestic abuse, we've seen a rise during the pandemic. I also want to pick up on the fact home working. So some of our members who work in contact centres, call centres that have moved to a home environment, again, some of them experience verbal abuse on the phone or online. And I think that's incredibly challenging when you're working in a small office in your home, working in your dining room, working in your bedroom, and how you can actually switch off from that online or verbal abuse over the phone, and how that then sort of impedes into your kind of home life. And I think that's been very challenging for some of our members. And again, I think Bill touched on this, the impact of COVID on staff absence and service delivery. I mean, we went into the pandemic with, impacts of austerity, shortage of staff across lots of sectors, staff taking time off sick with COVID, and that staff having long COVID, and staff moving around because of lots of reasons. People aren't necessarily getting the level of service that they want, and then that has an impact on staff. So I think, again, as Bill said, we are seeing quite a lot of issues as an effect of COVID. So I'm going to move on and talk a little bit about Unison activity. So back in 2018, we launched our End Violence at Work Charter, which was targeted at the community sector. And we now have around 50 community sector organisations who've signed up to this, so housing associations, charities, hospices. And more recently, Liverpool City Council signed up to the Charter as part of their commissioning agreement. And the Charter isn't, it's not really anything new here. It's very much, again, what Nick was saying about health and safety management around violence, aggression, having a policy, having managers responsible for implementing the policies, looking at lone workers, working with staff to report incidents, working with trade union safety reps to look at solutions, risk assessments, and then support for staff. As I say, there's nothing groundbreaking or new in here. It just pulls it together in a framework. And we're very keen to add to that list of 50 organisations that are working with us to implement this charter in their organisations. Talking about working in partnership and working with safety reps to promote a culture where violence and aggression is acted on, and members are reporting it and feel confident to report it. I think it's really, again, as previous speakers have stressed, it's really important to work with staff and their representatives. And this isn't really just a nice to do, it is a legal requirement. And Unison will train up our safety reps to be the voice of the workforce, to sort of check in on employers' risk assessments, to carry out joint inspections of the work environment, and also to be consulted on health and safety matters. And I think that it's the people who are doing the job day in, day out, who know the risks associated with that job. It's that thing about work done as work imagined. Sitting in our offices, we can imagine how work is done, but actually it's the people doing the work day in, day out that know where the risks are, know where the pinch points are, know where issues can flare up. So again, it's really important to work with trade union safety reps as the voice of the employees, raising those issues, and also changing the culture around reporting as well. And again, Nick's covered this really. So where you don't recognise the trade unions, you do have a duty to consult the workforce on health and safety matters through the health and safety consultation of employee regulations, and that can either be directly or via an elected representative of employee safety. So again, that's all part of changing that culture and working to tackle these issues. So just sort of focusing on some of the challenges from our perspective, I could have probably gone on to about 3 pages of slides for this, but I tried to pull out some of the key issues from how we see it and from our members see it. And I think probably the first 3 bullet points probably are quite similar. I think there is too much, I think there's too much of a focus on reactive approaches rather than prevention. And there's some excellent, by reactive approaches, I mean sort of support following an event, following an incident. And again, absolutely essential that support, we do react to incidents appropriately, and good support is put in the terms of counselling, trauma support, peer support, all those initiatives. But I think what we sometimes find is employers put that in place, but they actually don't think about the prevention. So I think the two, you focus on prevention alongside reactive support for individuals, and also learning from incidents as well comes in there. There's probably a lack of focus from our perspective on the work-related factors. So, what can we do to make work safer? How can we design out violence? Can we design out violence? And in some instances, we can't necessarily design out violence. So, what can we do? Do we look at sort of good training? Do we look at things like body-worn cameras and all the things that Bill mentioned in his presentation? And I just want to pick up on quite an interesting piece of work that was done by the Design Council in the health sector a few years back, looking at design of A&E departments and how we can reduce violence in A&E. And I think there are sort of transferable lessons to lots of sectors. And the Design Council weren't just looking at, the layout of the environment and how people move through the environment, what information is available to people about things like how long they're going to be waiting for, what being triaged means. So it was all that sort of design stuff there, but it was also, they also looked at things like shift patterns. And in their research, they found that actually incidents were peaking towards the end of a 12-hour shift. So fatigue was a factor in how well somebody could sort of de-escalate an issue. So again, things like shift patterns can impact on the management of violence and aggression. So long shifts, back-to-back shifts, when people are tired and exhausted, that can limit, their ability to de-escalate situations. So it's sort of thinking more widely than just the work environment, the work practice, thinking about the work practices as well. And I think, as health and safety practitioners, it is about the hierarchy of controls. Can we eliminate it? We know we can't in certain circumstances where it's to do with the person's condition, but we can take steps to reduce those risks through having the right numbers of skilled staff, having the right training, and actually reviewing those risk assessments as well. So yeah, I think that's really important. We've touched on lone workers already, and again, I think they're a real concern, out of sight, out of mind. So what are we doing about lone workers? And also hybrid workers. So, this is the new buzzword, hybrid working, agile working. So people may be working from their home base, but then going out from their home base to visit another environment, visit a client, visit another employer's premises. So how, are we ensuring those hybrid workers are kept safe? And I know IOSH has some good guidance around lone working and hybrid working around safety of those workers. I touched on online abuse, and I think again there's some evidence that that is rising, and sexual harassment and violence against women, which sadly hasn't been far from the headlines the last few days. So again, we believe that the harassment and violence agendas sort of need to be sort of brought more closely together and treated as a work-related issue as well. And again, these may fall outside the scope of the Health and Safety at Work Act, but things like, how are workers getting home at the end of a long shift? Are they having to walk down dark alleyways? Do bus timetables run the same time, public transport run the same time as shifts ends? Are there things that you can do to make that environment safer? And I know, like a lot of NHS organisations have security escorts to take people to transport hubs at the end of long shifts and that sort of thing. I mean, I think there's a bigger argument then about how society, how violence to women is, you know, it's a societal issue, and you know how we need to tackle men's behaviours. But in the meantime, I think there are things that employers should be looking at. And even, you know, domestic abuse, it does overlap into the workplace as well. So where person is in their normal working environment, the perpetrator may come into that work environment. So if they're in a front-facing role, or if they've got the same shift patterns day in, day out, then you know that makes them more at risk from the perpetrator. And so again, I think that whole issue needs to be looked at as well. So empowering employees to say it's not part of the job, and again, you know, previous speakers have touched on this, but I can't really stress this enough. You know, there is sometimes certainly in health and care, there's a stigma with reporting incidents. People feel that they were wrong, because if they had done their work in the right way, then the incident wouldn't have happened in the first place. So there's stigma. There's also sort of people are frightened about the repercussions, so that the blame culture again comes in here. People worried if they report an incident, you know, they may end up the one going down sort of a disciplinary process. So again, the culture is really important. And also, and again, I can't stress this enough, around feedback mechanisms. So when people do report, it's at least acknowledged, it's investigated, and if, you know, if things have changed, if things have improved, then what the employer is doing to tackle the issue, or at least what they're doing to look at the issue, be that a review of the risk assessment, which is essential and often doesn't happen. And again, I suppose we would like to see more inspections and more enforcement action coming out of those inspections, because it is a way of getting employers to focus and to improve the management of violence and aggression. And yeah, I mean, I suppose we'd like to see the HSE better resourced so they can carry out inspections and enforcement activity. I suppose that's a caveat to add there. So I just want to highlight this case, because this is a very recent case which came up on the Health and Safety Executive's prosecutions pages on the 22nd of September. And it's a really shocking case, which is around lone working and around violence against women. So it was a service user who assaulted and sexually assaulted and raped a carer in 2018. And I think the most shocking thing about this case, if you can find it on the HSE's web pages, most shocking thing about this case, obviously the individual was in receipt of long-term care, but the staff started reporting incidents back in 1994. So that is over 25, well, about 25, just under, yeah, under 25 years ago. So when the incident happened. So yeah, absolutely shocking. And so again, I don't know the details of what happened in this case. So we've only obviously got access to the press release. But I think it should send out shock waves to everybody who employs lone workers, in all sorts of environments to do more. And that was done, that case was taken under Section 33 of the Health and Safety at Work Act, as well as Section 2, and also Section 3 of the Management Regs, suitable and sufficient risk assessments. So finally, just to say sort of what we can do and what we would like employers to do. So obviously Unison will further promote our charter, follow up with employers around how they're implementing it, and look to gather good case studies of where it's been implemented. We'll continue to recruit and train union health and safety reps and empower our members to know their rights under health and safety as well. So that's obviously activity that we'll continue. We want to do more around recognition of gender-based violence, sexual harassment as a workplace issue, and looking at some work around ratification of ILO Convention 190, and also taking forward more work around domestic abuse as a workplace issue. So employers out there, we look to sign up to the charter with us and really work with your employees and your trade union safety reps to try and change the culture in your work environments. And so contact, if you are interested in signing up to the violence charter, as my colleague Andrew Doby leads on that, so he'd be really interested to hear from you. And thank you.
Thank you very much, Kim. I really appreciated that. Very powerful as well, that last case. Mindful we've got about 5 or 10 minutes to do a few questions because we have to finish promptly. I guess it's one for probably Bill, because he covered this in his presentation. There's been a number of comments in the question and answer slot about this reporting issue and getting people to report it, as Kim's just said there. And one of the questions that somebody asked is, if you're doing these surveys, sort of health and safety culture survey around violence and aggression, and you've kindly offered access to some of your materials there, Bill, over October. Is there something in there that people could use that finds out, because some of the comments we've been getting in the chat is, it's part of the job, social care, NHS, no one listens, it happens all the time, why do we bother reporting it? To just find out how deeply embedded that goes within the culture.
Yeah, I just think that's the long-standing challenge, really. I personally, I think Stuart, the biggest, the best way to encourage people to report is to do something about it when they do. And I think it's about, I appreciate, we can't fix the world, but I think it's just that, something Kim's very passionate about is, just how are we following through, showing that we are taking, that even to the point that we've received this, and thank you, and we are looking into this, we are doing something, and we feed back, whatever it is, we feed back, follow up feedback. I don't think it takes much. I think people naturally, just if they just become cynical, if there's nothing coming back. The training, yes, the training does look at the things for managers as to what are barriers, like not feeding back, but also tries to encourage colleagues as to why important, it helps to focus resources to help them, for example, why it's valuable. But I think the biggest thing we can do is, well, 2 things really. One is making it easy as possible. There's a lot of creative approaches out there now for quick reporting, just doing that very quick report off a phone or another mechanism that just flags it. Make reporting simple, and secondly, get back to people.
All right, thanks for that, Bill. Mindful of time. Next one really for you, Nick, is obviously, I said I wouldn't give you a real tricky one, but obviously people were very interested when you said sort of 20, you did those 20 visits, 50% of them had issues, and in some cases you probably could have taken material breaches. One of the things that was coming out of that is, on your website, your Maybo site, can you, as you do these enforcement, give more information or guidance around what sort of issues there were? For example, one of the questions was around competency of managers. Are they expected to be health and safety managing violence in the sector, or does it recognise more nuanced that managers might have a lot of training around managing cases, particularly NHS and healthcare sectors and things, but nothing officially that says health and safety and violence and aggression. What's your views on that sort of approach?
Yeah, thanks, Stuart. In terms of sort of sharing more detailed information about the inspections, that's something I'll need to take away and speak to my colleagues in the health and social care team about. I'm not quite sure what their plans, if any, are to sort of put something more broadly on our website in terms of the outcomes of those interventions. But it's certainly something I can take back to them. And obviously let them know that, you know, from this meeting that there is an appetite for that. I think regardless of the nuance and the detail, I think there's still some key aspects of the findings from those inspections which can be taken on board and can apply across the piece really, and not just to health and social care. And I think that's probably the important thing to take away from that. But yeah, I can certainly follow that up with them.
And I guess it's one I'll pick up here, and we'll do it offline. There's one query about staff warning registers. We've just used an example of a case. For years, this case was building up. There was a whole load of information. I'm certainly aware of the case of the social worker who was stabbed in the back. I think it was up in Newcastle, where everybody knew you don't turn the back on this individual, apart from the poor person who got stabbed in the back. What is getting for you, Nick, is staff warning registers. The Information Commissioner's Office produced fairly detailed guidance at one point, and it was withdrawn, I guess, because it was just so thorny legally between the health and safety aspects and the privacy. Is it something that, in that micro side, something the HSE could actually give a bit of a steer on, or is it something that IOSH would be expected to? Because I know I've introduced an awful lot of staff warning registers in my time, so I have a fair bit of experience, but it's something we would really appreciate to have the statutory backing.
Yeah, well, I'm personally not a sort of an information sharing or GDPR sort of expert, but by any means, and neither would, you know, my colleagues, I think, put themselves up as such in terms of addressing that matter head on, in terms of providing advice on it, because it's not really our legislation to advise on. I think that the key thing is not to just use that as a sort of generic barrier or reason for not sharing information, without actually looking more in depth at what the actual requirements are. You know, does it really prevent me from sharing this information? I mean, clearly, if there are safeguarding issues and so on there, then I think by and large that's likely to trump most of the requirements in terms of restrictions on data sharing. But I think generally, yeah, it's don't just take it at sort of, I say, well, I know there is GDPR out there, and therefore I think we can't share relevant information. I think it's actually look at what are the restrictions. Is there really a barrier to doing this, or is it just something that, you know, people are putting up themselves without really understanding the requirements and the restrictions?
Thanks very much, Nick. I'm mindful of time. We'll wrap it up there if that's okay with everybody. I've seen there's a couple of questions come in while we were online. We'll pick up those questions, we'll put an answer on, and we'll upload that onto the IOSH Public Services microsite. And if we have to signpost people to other things, we'll signpost. So thank you very much for your attendance, and have a safe afternoon.